Well, thanks for having us. We're really happy to give this presentation and give an update on our work in Vietnam, and really appreciative of all the collaborative speakers we have today for our project. And so today we're going to talk about the work we've done to move pediatric bone marrow transplant forward in Vietnam. And really happy to have Dr. Phu here, who's done a lot of this work for us. So I'm going to give a few intro slides, but I just wanted to introduce everybody. So I'm Anu Agrawal. I'm a pediatric oncologist, primarily in Oakland, at Benioff, Oakland, and done a lot of international work and have been fortunate to do this work in Vietnam with Michelle Hermiston over there in San Francisco and others who are on this call, as well as multiple collaborators, which Dr. Phu will highlight. And I left up this slide from World Cancer Day in 2016 because we've been working in Vietnam since that time. Dr. Phu? You're muted.
Hello, I'm Dr. Phu Huynh. I've been a doctor at the Stem Cell Transplantation Department of the Blood Transfusion and Hematology Hospital, and I'm also the manager of the clinical research and training department. I'm also the moderator of the Vietnamese pediatric hematopoietic stem cell transplantation and cell therapy task force. I'm happy to be here to join this interesting conference. Thank you so much.
Thanks, Dr. Phu. Linda?
Hi, I'm Linda Abramovitz. I'm a nurse working with this collaborative team. I've been working with and partnering both the nurses and physician and other team members for the last years in Vietnam. I'm advanced practice nurse and currently a non-salary faculty with the Global Cancer Program at UCSF, as well as the School of Nursing.
Yeah, and Linda brings decades of experience in transplant as well as international work. So has led the Society of Pediatric Hemonc, International Society of Pediatric Hemonc Nursing Collaborative for many years. Nancy?
Good morning. My name is Nancy Noonan. I'm currently the stem cell transplant clinical nurse specialist at Children's Hospital Oakland in Oakland, California. I'm very happy to call Linda one of my mentors throughout my long career. I joined with the consortium work just in time for COVID to start. So my experience has been over Zoom, but I'm very much looking forward to increasing my active participation in the next year. I'm really, really excited about this. Thank you.
Nancy's retiring soon, so she can focus on this work. Exactly. And then Hannah?
Hi, everyone. Nice to see you all. I'm Hannah. I am one of the pediatric residents at UCSF and also in this global health pathway. So it's been really fantastic to learn about lots of exciting work, and I've been really fortunate to be able to collaborate with this team starting my 4th year of medical school, and have been working on a project related to SOPs for bone marrow transplant, which I'll talk about later this morning.
Yeah, we chose the speakers. We had a reason for choosing the speakers. We wanted to really highlight the collaborative aspect of the work cross country, internationally, but also just the multidisciplinary nature of the work with both nursing and physicians and others, psychosocial care. And then finally, one of our focuses also has been on training and mentorship, both internationally within country, but also locally as well. So I just wanted to spend just a couple minutes briefly reintroducing why we're doing this work. And I think that this number is no longer accurate, but and then the vast majority of children who are dying from cancer are not dying from cancer in the United States or other high-income countries. It's in low and middle income countries and in places like Vietnam, who are really dynamically changing, economically moving forward, building infrastructure, have really moved forward from the under 5 pediatric mortality due to malnutrition, diarrhea, et cetera, and are really now focused on trying to provide subspecialized care. And so it's really very an honor and privilege to help in partnership with them to achieve that goal. So, some of the decisions as far as where you work internationally is somewhat based on serendipity. And We became involved in this project largely because of a UCSF resident who's Vietnamese, and he connected all of us with this work. But also Vietnam is really an ideal place, as I mentioned. There's a huge opportunity to make an impact, but at the same time, there's a really push to improve the infrastructure, as well as we've always, whether we're in country or not, we're always really motivated by the partnerships and the physicians and other staff there who are really focused on improving the care there. And that's been really the best part of the project. And then I think some of the other things is working to really change how people view cancer there, and working to develop a registry of data management. So we've really focused on training, building capacity, and then coming up with standardizations of care based on the standardization of care that we use here. And bone marrow transplant is a really great opportunity for that because it is very standardized and protocolized. And so we'll talk about that today. And then we really want to be able to get more data to understand the outcome of our work. So that's something in process as well. And so we've taken a stepwise approach. We're really still, even after all these years, really focused on step 1 and 2, although we're hoping to move towards step 3 and 4. And so it's been a twinning partnership focused on training at all levels, multidisciplinary, collaborative, and that's been really our focus so far. And we had 3 initial pillars, which are really still focused on twinning, training, and research. And so that's been our kind of mission. And so today we're going to talk about the work to date so far in helping to build bone marrow transplant across Vietnam. So with that, I'll let Dr. Phu share his slides.
Yes, thank you, Dr. Anu. Let me share. I share screen. Okay, great. Can you see my slide?
Yep, looks good.
Okay, thank you so much. Good morning, everyone. It's truly an honor for me to collaborate with many wonderful experts from the UCSF, like Dr. Michelle, Dr. Anu, Ms. Linda, Ms. Nancy, and especially your dedicated medical students like Hannah. And I'm also delighted to be here to share a presentation about the current activities of the Vietnamese Bone Marrow Transplantation Consortium. Throughout my presentation, I'd like to provide an overview of a history of pediatric stem cell transplantation in Vietnam, and I'm going to share the current status of our transplant program, and particularly activities of Vietnam Pediatric Stem Cell Transplantation and Cell Therapy Task Force. And finally, I will introduce briefly our upcoming activities for years 2023 and 2024. Based on the most recent data from our government, approximately 1,800 Vietnamese children were diagnosed with cancer every year. And among these cases, nearly half are leukemia and lymphomas. Condition can potentially be treated with chemotherapy and stem cell transplantation. The cancer center for children in Vietnam are located mostly in major urban cities like Hanoi and Ho Chi Minh City. However, until now, there are only 7 active transplant centers in Vietnam. Among these centers, 3 centers are located in the northern region: Vietnam National Children's Hospital, VNCH, National Institute of Hematology and Blood Transfusion, NIHBT, and VMEC International Hospital. The central region has only one center, which is a horizontal hospital. And in the southern part, we are home to 2 transplant centers, a blood transfusion hematology hospital, PTH, and the Children's Hospital number 2. We are fortunate to receive a lot of support from many organizations such as the UCSF, University of Texas, University of Florida, Century Global Organization in the US, or KK Hospital, and US in Singapore. We are also grateful for the financial assistance from some nonprofit organizations such as PsyOp or ACCL or the Kids with Cancer Foundation. Thanks to this support, we are witnessing the gradual improvements in the outcomes of the pediatric cancer treatment in our country, better in the past. Taking a glimpse into the history of pediatric stem cell transplantation in Vietnam, we found that PTAT took the lead back in 1995 with the first bone marrow transplantation for children, followed with the first cord blood transplant in 2002. In 2006, 2 additional transplant centers were established, NIHBT and VNCH. And our efforts extended to the conduction of first haploidentical transplant and untreated transplant several years ago. Then came to a significant development in 2019 when the Rees Hospital started its transplant center with the support of PTS team and international experts. And fueled with the idea of collaborative enhancement, Vietnam Pediatric Stem Cell Transplantation and Cell Therapy Task Force was born. Concurrently, Children's Hospital set up a transplant center, and looking ahead, we anticipate the establishment of 2 more transplant centers in Ho Chi Minh City, Children's Hospital number 1 and City Children's Hospital over the next few years. Here are some results of the pediatric stem cell transplantation in Vietnam. From 2020 to 2022, despite the pandemic period, about 50 to 60 Vietnamese children underwent the stem cell transplantations every year. And however, this figure falls short of the total number of children for whom the transplantation was indicated. Among these centers, VNCH, NIHBT, and PTAT have handled the majority of cases. While all transplant centers can do autologous stem cell transplantation, only 3 transplant centers can perform allogenic transplant. When it comes to the indications of the pediatric stem cell transplantation in Vietnam, neuroblastoma stands as the most relevant reason for autologous stem cell transplant. On the other hand, aplastic anemia and AML collectively contributed to the 50% of cases requiring allogeneic stem cell transplantation. However, our database has not yet collected the outcomes after stem cell transplantation across the centers in Vietnam. I'd like to present some most recent data from BTH. In the cases of aplastic anemia and AML, the outcomes after stem cell transplantation have been truly successful. However, we observed a significantly worse outcome after stem cell transplantation in LL patients. The median overall survival was just 11 months. There are several contributing factors to this problem. Most patients received the stem cell transplantation following relapsed or refractory ALL, and we lack access to a novel therapy or treatment that could help our children achieve the remission before the stem cell transplantation. And the absence of a TBI and FIO-TBAR in Vietnam, which have shown a promising results in conditioning for ALL patients, is another challenge we face. In the process of conducting a transplant program, we have a lot of advantages. Our Vietnamese doctors and nurses always express enthusiasm to have the opportunities for training. Our robust network across the centers in Vietnam allows us to share invaluable experience and discuss a strategy to strengthen our programs. And it's noteworthy that stem cell transplantation isn't taught in Vietnam's medical schools. So I really appreciate the strong support from many international organizations and experts. And however, we've got a few challenges on the plate. First of all, we are short of some important drugs needed for stem cell transplantations, such as the these are crucial when it comes to tackling some complications after stem cell transplantation, such as VOD, TMA, or GVHD. A scarcity of essential supplies or equipment, particularly during the pandemic period, could lead to the treatment delays or even right after treatment cost. Our transplant team always encounters some difficulties in stem cell transplantations, like not having enough specialized training or dealing with a heavy workload, or that can lead to burnout. And having a well-prepared exobees can help our staff to ensure what they're doing and minimize confusion. However, just a handle of a stem cell transplant centers can have the capacity to develop their own SOB system that actually demands a lot of efforts and time. Just only a third of children who required a stem cell transplantation actually got it. The main reason is that the cost of a transplantation is sky high, but the insurance doesn't cover much. And we don't have donor registry here in Vietnam, and the birth restrictions in the back could make it tough to find a matched sibling donor. And not to mention, we don't have a solid long-term follow-up plans for survivors, so we could meet some late complications in these patients, and especially it may impact their quality of life. So to deal with these issues, Vietnamese pediatric stem cell transplantation and cell therapy task force was established in 2020. Dr. Michelle, Dr. Anu, Ms. Watanabe, and Dr. Shali kicked this effort to build stronger connections both within and outside Vietnam. Our aim is to assist both new and established transplant centers in our nation. Moreover, we are collaborating to devise a shared exobees for stem cell transplantation and cell therapy, guided with the experience of international experts, but tailored to their unique realities of Vietnam. And we also, the final goal is that we try to ensure the safe and effective transplant for our children in Vietnam. On transplant centers, I'm a member of the Vietnamese Association of Pediatric Oncology. We always work together using group chats or national meeting or conference to communicate about the pediatric oncology. So this way we can understand what each transplant center needs or what are their difficulties, and we can discuss things like a database or project plans, and task what will play a role like linking up the members with the international experts who can give advice, provide nurse training, or run the PHO program, or operate webinar, or organize a conference or workshop. A big thanks to Ms. Watanabe for this awesome graphic showcasing our milestones about task force. Our webinars usually held on the Thursday during the last week of each month. And we've covered a wide range of topics related to the pediatric stem cell transplantation. And I really appreciate the contribution of many experts from the UCSF, like Dr. Michelle, Dr. Anu, Dr. Huynh, and other doctors from other hospitals in the US, Germany, or Thailand, or India for their fantastic presentation. And here's what goes down in the regular webinar. First up, we start with our presentation from an international expert, and then it's time for a productive discussion where our local doctor will put forward their challenges at their hospital, and our international expert will chime in with their practical insights. And I think these sections are like the precious learning opportunities for our medical team, giving them knowledge that they can put with work in their daily clinical practice. And we try to incorporate case discussion between the lectures, or we will try to present 2 or 3 challenging or interesting cases from different transplant centers. And these sections are immensely beneficial because it provides our young doctor a chance to practice presenting clinical case in English and actively participating in discussion with international experts. And supporting a new established transplant center is an important activity of our task force. Our endeavor is to is to try to increase the possibilities for Algerian to approach the breast treatment without traveling so far or spending too much money. And in this picture, PJ's team was helping the Huynh Central Hospital for their first case of autologous stem cell transplantation. And after several years, these transplant centers gained the ability to independently operate their transplant program. And the excellent experts from our task force are also the dedicated speakers at the National Conference on Pediatric Oncology and Stem Cell Transplantation. And these occasions are a chance to meet face-to-face and discuss the further activities to strengthen our transplant program in the future. And in this picture, the children who had completely recovered from the stem cell transplantation and chemotherapy joyfully sing and dance in front of the audience. Looking at the heartwarming scene, we felt a profound sense of fulfillment for our dedicated work we have invested for a long period of time. And Dr. Land, here's Dr. Land, who is the chair of the Vietnam Pediatric Oncology Association. She was leading a meeting to figure out the direction of our transplant program in the forthcoming years. Now, lastly, I'd like to introduce briefly about the upcoming activities for years 2023 and 2024. Our priority is to develop essential expertise applicable to all pediatric transplant centers in Vietnam to ensure the safety of the treatment. 20 pediatric stem cell transplantation nurses hold significant importance, I think so. And we try to sustain the support for 2 newly established transplant centers in Ho Chi Minh City, Children's Hospital number 1 and Children's Hospital, as we have done previously for Huynh Central Hospital and Children's Hospital number 2. And wrapping up my presentation, I want to share my gratitude for a chance to share our effort in the pediatric stem cell transplantation. I'm also excited for the prospect of the collaboration between the UCSF and Vietnam to improve the outcome of stem cell transplantation for our children in the future. Thank you so much.
Thanks, Dr. Fu. And I just wanted to highlight a couple points. One is the consortium has been a really nice way to get involvement of all the transplant centers and all the centers that want to perform transplant in Vietnam. I think that we have struggled to develop collaborations throughout the country and also to develop consensus. And this has actually been probably the most productive and fruitful way to do that amongst all of our activities, since we're actually considering similar consortiums for leukemia and solid tumors. Although we have tumor boards for those things, we've not necessarily been able to unify treatment strategies, et cetera, like we have with transplant. So it's really served as a really great model. And as Dr. Fu highlighted, without a donor registry, it can be difficult to find an appropriate donor for transplant if you're getting an allogeneic transplant. And so one of the speakers, Dr. Faulkner, has really pioneered doing haplotransplant, which can be from a sibling or a parent for thalassemia. And so now some of the centers have started to utilize that approach. And recently, one of the centers in the north did a haplotransplant for thalassemia successfully. And so that was a really great result that came out of the consortium and some of the collaborative work. Teresa, is it okay if we continue on and then take questions at the end, or?
Sure, yeah, that's fine.
Is that okay?
Please.
All right. Okay, great. Okay, all right. So we will move on to Linda and Nancy.
Okay. Can everyone screen okay?
Yep, perfect.
Okay, well, I'm gonna have Nancy launch this presentation. Go ahead, Nancy.
Great. Thanks for putting the slides up, Linda. Good morning, everyone. And thank you again on behalf of Linda and myself for this invitation to share some of our work. And also thanks to the consortium for encouraging nursing to have such a strong presence, because it is clearly important. Next slide, please. So nursing, as many of us know, nursing role in pediatric oncology and stem cell transplant is a vital role that nurses are at the bedside for hour after hour, day after day, providing that care. They're a link between the medical team and the patients receiving the therapy. But we also know that pediatric oncology and transplant nurses are needed because they need that specialized knowledge and skill in oncology and stem cell transplant, which requires adequate resources and supportive leadership. And at the end, then this provides a safe and effective pediatric oncology or transplant program. And again, we know that it's not possible without this expert and high quality nursing care. Next slide, please.
So our activities over the last 6 years have focused on several different areas. Initially working with the pediatric oncology patients with nurses and physicians, and then more recently in the last few years focusing on plant. So part of our activity has been visits to Vietnam to the various 14 oncologists, and now focusing on the 7 transplant units. And it involves a needs assessment, finding out what the nurses, physicians feel are needed in these units. We have made over the last probably over 50 hospital visits. I just came back from 6 days in Vietnam and had an opportunity to visit 4 sites, and that provides invaluable information and strengthens our partnership. During these the site visits, we provided educational programs at the sites, as well as a conference, and we'll talk a little bit more of what we did during COVID. The huge part of nursing activities has involved developing these leadership team. And this started very early on, identifying the stakeholders, the directors of nursing, head nurses, and key clinical nurses on each of the units, and then really having opportunities for them to meet together and really identify and form a plan for where they wanted to go with nursing. And this has been extremely supportive of physicians at each of these centers, which has been led to the success of all of this. I love this picture. This is at a local conference in Singapore, and in this photo is nurses from both the United States as international mentors. My colleague from Singapore, who's psychologists from University of Texas, director of nursing, a physician, and then Ms. Watanabe from Japan, who part of this huge support for parents and other activities. We were able very early on to develop a pediatric oncology nursing conference, which paralleled the physician conference was being given in Way each year. And we just had our 6th conference last week, which was very exciting. During COVID, and even prior to COVID, we started using Zoom as a way to educate nurses throughout Vietnam. We only could visit certain number of centers at any given time. So we were able to then really launch a very rigorous Zoom program during COVID, since none of us were able to visit. And I'll talk about that in a second. But we having 125 nurses at every session within the first few months, which is a huge number of individuals who've committed, because it's 8 p.m. at night we're doing this. The nurses have been mentored. We talk about, burnout, and I think that is huge in not only states for nurses and workload, but it's even greater in Vietnam with staffing ratios. So having nurses have opportunities to present locally within Vietnam at the national conference, but also helping then at regional as well as international meetings has been extremely positive. One of the challenges that we face is that many of the nurses do not speak English. And we've relied on translation, the support of our physician colleagues and elsewhere to really help share our information dialogue. when I went back last week, some of the hospitals have launched English classes for nurses. They got to practice quite a bit and motivated to present at some upcoming international conferences. So I'm very excited as we move forward. And then finally, nursing grant, 2 My Child Matters Sanofi S grants, to allude to one of them related to transplant, and we'll share more on that. So during our visits, this is rounding with the nurses, with one of the physicians, or one of our mentors from Singapore, a nurse, really identifying issues at the bedside and partnership. On the right, actually, Dr. Dewey is the radiation oncologist from Huynh, and we do a lot of discussion during our didactic presentation. So we really want collaboration between the hospitals and with the nurses. And then again, going back to the idea of burnout, we launched some healthcare program for this in Vietnam with a self-care toolkit. One of the presentations at Blood Transfusion Center was on the psychosocial needs of parents and children. And then I followed up with my colleague, Shelby Sandoval, who's involved in this project, on self-care. And so again, integrating both the physical care of these children along with the mental health or healthcare providers. And then this was in way our first grant had to do with developing a parent educational book in Vietnamese to be used at every single transplant as oncology in Vietnam. This has been successfully launched. And we are now looking at putting this online for the parents to link in on their cell phones. So we do not need copies and relying on funding for that. So that's been very exciting. Nancy.
So one of the key to our projects has been this collaborative interdisciplinary approach that we have international mentors and then the Vietnamese healthcare team interacting bidirectionally to provide support and to specifically address the needs identified by the Vietnamese healthcare team. Next slide, please. So the group is included from both sides. In the international side and the Vietnamese side are nurses, physicians, psychologists, social workers, pharmacists, nutritionists, child life specialists, advocates and parents, universities and hospitals, students, and in addition, on the Vietnamese side, the Ministry of Health, hospital administrators, all working together with global support of funding to be able to support these interactions and develop a baseline to move forward to provide the consultative care and learning opportunities that have been identified by the Vietnamese healthcare team. Next slide. So early on, some of the lessons that we've learned that collaboration depends on the ability to provide a supportive atmosphere for teamwork that includes trust and inspiration, the opportunity for exchange of ideas, to provide assistance to one another and support, to be able to share information without worry of bias or without worry of judgment, and also to really highlight those very important, maybe small, but still important successes, so that collaboration as an interdisciplinary team improves the quality of care. Everyone has their perspective, and when we come together, the perspective grows and encompasses the patient and the family. Mentoring and building relationships takes time. This is not quick. If we meet for an hour at a time, not a lot of work gets done each time, but it continues to build. And what's been impressive is the commitment by both the international mentors and the Vietnamese healthcare team members that they make to attend meetings at very odd hours of the evening or the morning. And this also involves a huge element of trust where you can share information and free from bias and judgment. learning from others and paying it forward is one of the key concepts, and the success and the payback to all the people who are involved. And at the end of the day, it's much more fun to work together than it is in isolation. Next slide. As Dr. Phu illustrated earlier, the Vietnamese Pediatric Stem Cell and Cellular Therapy Task Force was initiated early in in September 2020. It supports both new and established transplant programs in Vietnam to share resources and provide expertise and collaboration. And as a component of this, nursing has become involved and early on, and is then taking the information that's discussed in the medical perspective and translating that into the nursing realm of practice. It was very early on identified we needed a specific nursing task force, which was launched in March of 2021 through the identification of Vietnamese nurse leadership. And as you can see by looking at the flags and the times involved here, this really is a global effort from the US, Chile, Vietnam, Thailand, Singapore, Japan, and Australia. And then in addition, other team members that will provide presentations. Back to you, Linda. You're muted, Linda.
Okay, that's better. The initial discussion with and brainstorming with the nurse leaders regarding specific transplant and really addressing what nurses wanted to do with this task force came down to being more than on-the-job training, formalized education. Their initial experience in training, Dr. Phu alluded to, involved centers from outside the country, Japan, Taiwan, and then BTH Blood Center in Ho Chi Minh City really led and continues to lead training of nurses throughout Vietnam on care. The other thing Nancy just mentioned was the nurse could not very well participate in the educational meetings with the physicians because the meeting was in English. So we had to break out and look at having these presentations presented in Vietnamese. So what came from this brainstorm, it developed specialized training in the field of transplant, not only continuing ed, but a basic orientation when new nurses come to the unit. They wanted to go beyond the classroom and do hands training on the unit and look at clinical competencies that need to be achieved by these nurses over time. And examples very early on as we established the nursing piece of this program is myself, Nancy, and Ms. Trump from WAY presented on NG tube and nutritional transplantation at the physician conference, and we were able to do simultaneous screens in both Vietnamese and English. So it was a real meeting. One of the things that I just want to highlight right now is our current grant that we got from what was originally My Child Matters, but it's now called Sanofi S, and SIOP, the International Society of Pediatric Oncology, and UCSF Global Cancer Program has contributed to some of the funding. We were awarded $15,000, which is about $15,000 over 3 years, and it's not a lot of money, but we've learned to get things done in our partnership with very little money. And the focus of the grant is improving clinical and professional transplant nursing care in Vietnam. What we've done is these six baselines were established by SIOP many years ago, and it looked at what is needed to provide safe, quality nursing care. And you would agree with most of these elements, which staffing based on acuity, having an orientation, continuing ed, working as a multidisciplinary team, which includes nurses putting on rounds, resources for safe care, not only safe care for nurses, physicians, and other team members, but also safe care for a child and the family. And then evidence practice, and you'll hear more of that with the SOPs and Nancy's comments. So using this as a basis, we developed 4 goals, which are part of the grant, and I'm about each one separately. Developing an educational program to improve knowledge and skills. This was 6 days ago at our WAY conference, and we spent a piece of the time in the leadership group looking at how to develop our educational program. We decided very early on as we wrote, but also more in depth recently, is that we needed to follow what was so successful with our oncology nursing modules, which during COVID, and we created 13 modules at that time. They were given on a monthly basis. They were translated into Vietnamese. Our colleague, who's a nurse practitioner in transplant and singer, basically delivered the lecture with other international mentors on the call. Again, a huge nurses participated. We ended up having virtual case presentations by the Vietnamese nurses towards the middle of the session. This was extremely successful. I've alluded to, and the feedback is very positive. So we decided, why recreate the wheel? We are going to do a similar approach for a stem cell transplant. The nurses at the conference last week are putting together their top 10 topics and prioritizing, and then working as teams between international mentors and the Vietnamese nurses who do have experience in transplant, and then also identifying a physician at each center. We are going to create the most and deliver them over the next year. Where our program for oncology has gone is what we would hope we're going to do with our bone marrow program is focus on sustainability. About 3 weeks ago, we trained the trainer session, and each leadership clinical nurses are taking the oncology modules, bring them back to hospital, utilizing them in their settings, and we will have collect the data over the next year to look at participants as well as success by the presenters as well as the participants in sustaining this educational piece. So a delivery of information is wonderful to be able to share it with other nurses and continue that in their hospital setting. Capacity building is huge. We are doing that with our grant. The second year of the grant, we are going to take each will take a baseline standard that they select based on a survey that we're currently doing at each center where they want to improve. And this is a multidisciplinary project. This is us last week in WAY, physicians and nurses reviewing information, but we are going to have a quality improvement piece during the second year, which is really important to make changes and sustain that. Cultivating professional skills. I think you've all along that has been the major message, and it was amazing. Again, this was taking a week ago. This is the leadership meeting. It grew from 5 nurses, and this is our team. We had translators there for Shelby and myself and Ms. Watanabe, but 15 nurses from the multiple centers throughout Vietnam met and then made collective decisions on where we're moving forward. Again, this is a part, and we were very excited to watch the progress. We also saw mentoring by the Vietnamese nurse leaders of the younger nurses who attended the meeting, and role modeling Anu and Dr. Michelle and everyone goes to Vietnam. We role model the nurse physician relationship, which is a little bit different in Vietnam. We really feel that the physicians have supported the nurses every step of the way over the last 6 years. And I am, happy to watch what's been going on, bringing nursing to the table. And then following this is establishing annual transplants similar to oncology. And this happened quickly with the help of Dr. Fu and his son, the director of nursing at BTH. This is going to happen in November over Thanksgiving. Nancy, myself, and Bill Yano, who was the head of clinical head of the transplant program at UCSF, will be going. And here are the nursing topics that were selected Vietnamese nurses for us to present on. There'll be interactive sessions as well, and we're really excited to move this symposium together. Nancy.
So as we go back to looking at the SIOP standards, we wanted to be sure to incorporate evidence-based practice and resources for safe care as part of the nursing task force. Next slide, please. So in that same vein, you'll hear more about this in a little bit from Hannah, but nurses are going to play a critical role in the development of standard operating procedures to ensure that there is enough information that can provide supportive information for the nurses to provide excellent care at the bedside. So we know that SOP development is an interdisciplinary project. It requires collaboration amongst all of the centers in Vietnam to be able to achieve a goal for standardization of care. And interestingly enough, most of the transplant centers do not have nursing policies and procedures. They may have some medical policies and procedures, but most do not have the nursing policies and procedures, which is a critical component of providing comprehensive interdisciplinary care for stem cell transplant recipients. Also concurrently going on is a project safe handling of chemotherapeutic agents by healthcare workers in Vietnam. The project goal is to improve the safety of healthcare workers handling hazardous drugs across the board, all members of the healthcare team. And then simultaneously, we're advocating for implementation of those SIOP baseline standards that focus on resources for safe care and very safe care. We do not want to harm our healthcare workers. Thank you. Next slide. I have 2 summary slides. This is the first one, successes to date. This is wonderful to talk about. The Vietnamese nurses tell us that there's improved delivery of care to the oncology and stem cell patients and transplant families. We're going to work on measuring that. Advance the specialty of pediatric oncology and stem cell transplant nursing. We're providing recognition and reinforcement in Vietnam that it is a specialty. And these nurses, for the very first time, have participated not only in regional and national, but in international activities, which is awesome. The international members, we've developed a trusted partnership and collaboration with our Vietnamese colleagues. We've utilized the Vietnamese experiences to impact in other global settings. So we are learning lessons on a daily basis. And then we're highlighting the value that nurses bring to patients and families, no matter where they live in the world. Next slide. And then finally, how do we embrace the future and continue to build these bridges? Well, we use advocacy, advocate for the nurses to be better prepared and feel more confident in the care that they're providing families. We're collaborating with the entire healthcare team. We're providing nursing specific contributions. We're developing leaders within the Vietnamese nursing community. As international stem cell transplant experts, we're providing mentorship, not direction, but mentorship. And then we're also partnering with our international colleagues, specifically with our Vietnamese nurse colleagues. And at the end of the day, it's all about being good global citizens and supporting the Vietnamese nurses to develop their skills and programs. Thank you.
Thanks, Linda and Nancy. And just to highlight a couple important points, that it's a paradigm shift in many international settings to change the hierarchical model of care. And it takes a lot of time and definitely, as was highlighted, partnership. So we've really focused on the nurses being advocates for the patients and feeling that they can speak up and not that their voices are suppressed because of the hierarchical model. I think the other challenge in a lot of international settings is the nurses have to rotate through multiple different fields, and they may be in oncology for a while or transplant, but then move on to something else. And that is really non-ideal, especially if you're trying to develop a certain skill set, which is really important. So that's also a significant paradigm shift that we're working with our partners in Vietnam. We're really wanting to embrace, I would say, the high income country or the Western model for multidisciplinary care. So it's been really a pleasure to see that process move forward, albeit as stated, slowly. So, all right, we'll move on to Hannah.
Sounds good. I'll share my screen. Okay, does that look all right to everyone? Great. So I'm really excited to share some of the work I've been fortunate to collaborate on, focused on evaluating barriers and facilitators to implementing SOPs by the consortium we've been talking about today. Briefly, I'll touch on our study design, our preliminary findings, and ongoing implementation efforts and collaboration. Briefly, some background. To promote quality care in hematopoietic stem cell transplantation, the Foundation for the Accreditation of Cell Therapy, or FACT, requires use of standard operating procedures for accreditation in stem cell transplant. So FACT is a North American-based organization, and JC, its European counterpart, is the kind of broader international organizations that oversee this accreditation process. Taking a step back, what even is a SOP? An SOP is a standard operating procedure or a document that provides step-by-step information on how to execute a task in a uniform manner. SOPs support the meeting of compliance standards required for accreditation. They standardize procedures and approaches to common clinical scenarios. They ensure everything goes according to schedule in clinical care. They can serve as a training document, and they really aim to minimize adverse events and maximize patient safety. So with all of this in mind, it makes sense that accreditation has been associated with improved patient outcomes. So patients undergoing allogenic stem cell transplantation at accredited centers have higher relapse-free and overall survival compared to patients transplanted at non-accredited centers, which we see on the survival curve on the bottom left here. Additionally, accreditation has been associated with superior overall 3-year survival, with the largest difference being seen for more complex stem cell transplantation, which is illustrated by the curve on the bottom right. And the gap we're aiming to address is the fact that the development and use of SOPs for transplant has been identified as a priority by the Vietnamese Pediatric Transplant and Cell Therapy Consortium. Additionally, baseline assessment of capacity has revealed that none of the consortium hospitals currently use SOPs that are required in entirety for FACT JC accreditation. And then furthermore, there's a paucity of literature outlining best practices and how to go about implementing SOPs and achieve accreditation for transplant in more resource-limited settings. As a result, the aim of this project is to examine barriers and facilitators to implementing SOPs for pediatric stem cell transplant across the consortium of hospitals in Vietnam, using CFIR, which is the Consolidated Framework for Implementation Research and is one of the more commonly used theoretical frameworks for implementation science research. I'll move quickly through our methods for the sake of time, but we conducted this study through individual semi-structured interviews using CFIR as our methodology. And our participants included 9 physicians and 6 nurses across 8 consortium hospitals. 5 of the hospitals have existing established pediatric transplant programs as highlighted by the blue arrows below, and 3 hospitals planning on initiating transplant hopefully within a year. Then taking a step back just to kind of frame where we are today. So the goal of this qualitative study is to identify barriers and facilitators to use of SOPs, which I'll speak about in a moment. And the hope is that these findings would help us tailor a formalized implementation strategy for developing and using SOPs across consortium sites. Diving into our data here, I can orient you to this slide. So the columns on the left, CIFAR domains and key constructs. I think what's important to know here is that CIFAR has a menu of domains and constructs that have been shown to be associated with implementation of evidence-based practices. So as barriers and facilitators emerged from our qualitative data, we mapped these findings to CIFAR domains and constructs. Diving in, the first barrier that we identified from our data is that there are inconsistent audits of SOPs performed by department leaders who have competing priorities. And I think this finding is highlighted really nicely by a quote from a nurse who noted, "The challenge is knowing how to check whether these protocols are actually implemented on the floor. Currently, we will either just randomly quiz the nurses and the doctors, or just randomly observe. And if someone is, for example, missing some of the steps, we will correct that person. We'll give feedback right there, but we don't have a tracking record or systematic way to check it. Currently, we are relying on leadership to check, and it's not done consistently." The second barrier we noted is that there's variability in insurance coverage and access to medications required for evidence-based care. The third is that there is a lack of coordinated approach for developing and distributing SOPs within and among consortium hospitals. The fourth barrier is that there's high workload and limited time among providers that ultimately hinders use of SOPs in clinical care. Moving down here, the fifth barrier is that length and complexity of existing SOPs has limited provider engagement with these documents. Switching gears to some facilitators that emerged from our data, we learned that there are existing hospital-based mechanisms for approval of SOPs for use in clinical practice. Checklists concordant with SOPs have been helpful in facilitating their use in clinical care. The third facilitator is that there is perceived adaptability of SOPs across consortium hospitals. The fourth is that there's a utility of SOPs in training providers in pediatric transplant. And finally, there's a shared understanding that SOPs improve quality and safety of patient care. And I think these last two facilitators are highlighted nicely by a quote from a physician who noted, "In my hospital, we have frequent rotation of nurses and doctors, and this is not good at all because new nurses require more time for training. We train all day and all the time." So I think if we can have SOPs, the first benefit is that we can use it as training material to make sure that every nurse can follow it, or younger doctors who don't have as much experience in stem cell transplantation. We can ensure safety during stem cell transplantation for our patients. So with this data, we have worked on iteratively designing a stepwise approach to implementation for SOPs. So we incorporated data from our interviews, focus group discussions, both in country and facilitated over Zoom, as well as an SOP workshop that I was able to participate in actually this past spring. So now I'm going to share kind of the working implementation schema for SOPs, starting with the column focused on SOP development. So the first step we proposed is defining an essential list of SOPs for pediatric transplant in Vietnam, followed by then selecting and developing each individual SOP, and then sharing this SOP among consortium hospitals for adaptation to local settings and local hospitals. Next comes reviewing the SOP by pediatric transplant and local hospital leaders, which will involve revising the SOP to align with local standards of care and local hospital settings. And with this comes the important incorporation of document version control. After revisions, the SOP would then get approved by local hospital leadership, which all hospitals have kind of existing structures to support this. And then would come stakeholder training to train providers around use of SOPs clinically. Following this, we hope to introduce use of the SOP in clinical practice, audit use of SOPs and identify areas for improvement of use of the document, and addressing areas for improvement via quality improvement and revision, which loops back to revision and development. And lastly, we're thinking ahead about research in this space, and we hope to kind of create a standardized database to collect data around transplant, facilitate collaboration across consortium hospitals to analyze findings, and ultimately disseminate results in Vietnam and globally. And all of this taken together is our stepwise approach. And then I've added below, kind of superimposed the data that emerged from the qualitative study just to show how it maps to this proposed strategy, and can kind of focus in now on the development arm, which is where we currently are in our real-time implementation efforts. And here we're really trying to leverage the facilitator that there can be adaptability of these SOPs across consortium hospitals, and we don't have to reinvent the wheel in each setting. And also acknowledging that right before this project, there hasn't been a coordinated approach for developing and distributing, and so trying to leverage that in a more coordinated manner. In terms of where we are today, so far in our implementation efforts, we've created an SOP database, so potentially like a list of all potential SOPs based on the hundreds of SOPs that we have for pediatric transplant here at UCSF. We then collaboratively reviewed and proposed an essential list of prioritized SOPs based on preferences and needs expressed by providers at the consortium hospitals. We then disseminated a list of SOPs for consortium hospitals to sign up and develop SOPs. And these are teams of doctors and nurses who will take ownership over developing that SOP. Kind of next steps and work in progress is pairing international colleagues with each hospital to support SOP development, as well as continuing to facilitate consortium-led meetings to work on development and then dissemination and adaptation of SOPs to different settings. And I'll pause there to allow for some time for discussion and questions, and for anyone from the team to please jump in and add anything that I missed.
Thanks, Anna. Yeah, we wanted to leave at least 10 minutes for just a general Q&A. So I think that the SOP project is really great because it just highlights just the need for so many things, and also just the really need for collaborative projects that really focus and drill down on some of these really vital details, which we sometimes take for granted here, but are really important to having a successful program, especially in a very, very specialized area like bone marrow transplant.
So people can come off mute or put your question in the chat. My question from before was actually about the bone marrow registry and kind of what are the barriers, and where is the country in the process of creating a bone marrow, I guess, donor registry?
It is question for me.
Yeah,
Yeah,
I think
Yes.
probably.
So yeah, thank you for this interesting question, because we have many discussions about this problem many years ago, because you know many doctors from the US or Germany went to my hospital and have a discussion about how to implement the registry in Vietnam. However, we figure out some difficulties we may have. First of all, we need to have a funding for the registry, because we have done many tests at the same time, like HLA testing, and especially we don't have any funding from the government for that project, and it's very difficult to get a lot of samples at the same time, because the cost of the HLA testing in Vietnam is around $500 to $1,000 for one sample, and we cannot do a lot of samples at the same time. It requires a lot of money. And another thing is that about the I think the public awareness, because sometimes we need to do a lot of education for the public, you know, because many Vietnamese people understand that if we donate the bone marrow, it will affect their health, and maybe it will give sometimes because we need to use some drug like G-CSF after before collecting the stem cells. So they think that if they have that drug in the body, that may affect their health in the future. So they don't like to donate the bone marrow at all. Yes, a lot of things. So this is I think the two main reasons to hinder that project. We try to figure out how to deal with all of that problems, but I think it takes time and effort. But until now, we try to connect with another registry at another nations like Taiwan or China. We also have under transplantation by shipping the bone marrow or stem cells from Taiwan to Vietnam for transplantation, but it costs a lot of money, and it just a few patients can afford that that cost of treatment for that transplant.
Yeah, we did try to look at this, and transplants dynamic, and there's been more and more data now coming out about doing haplotransplants, because this is an issue even in the US, especially for Asian and African American populations who have hemoglobinopathies, because the majority of even the US registry is Caucasian, and so we face this issue in the US. And so the ready availability of a haplodonor, either a sibling or a parent, really makes it a much better option in many places, including high income settings. And there are now more and more data showing that with the appropriate manipulations, that this outcomes can be equally successful for both hemoglobinopathies like thalassemia as well as leukemias potentially. So I think it is probably the better way forward, and it's something that we've discussed. And the other overlying issue is that under 5 in Vietnam, you're covered by the health system, but as Dr. Fu was alluding to, over 5, you're not. And so that's an incredible challenge when you're getting into these expensive therapies.
Yes, I have a question for Ms. Linda, because I have read the proposal for nurse trainings in the next 2 or 3 years. So, but I wonder that the nurses from different transplant centers will have the different experience and level of knowledge. And I want to know, can you suggest a way to close that gap so that we can make sure that every nurses who participate in your program can get the same understanding, the same knowledge after the training? Thank you.
That's a great question, Dr. Hu. We want to use expertise, particularly nurses at BTH and BINMEC who are doing transplant, as well as in Hanoi at Children's. So we're going to be pairing with mentors. I think, you know, if I pair UCSF and on the west side, let's say it in San Francisco, and Children's in Oakland, there is going to be a difference in approaches from a team, from physicians, from nurses, but there's some very basic foundation knowledge that we could build on. So I'm hoping that it will some basic knowledge with the SOPs, since they're going to be a collective agreement involved, could lend itself to some structure and, you know, bridging some of the differences between the center. I would imagine each center is going to have a little twist on how they're going to deal with mucositis or other issues. And I think that's appropriate, because that's what happens everywhere else in the world. So I think with the mentorship and including the Vietnamese nurses with our international mentors, we'll come up with a solid presentation, did with oncology, and then discussions, et cetera, from there. So things could be tweaked a little bit. But I think it's an important having that in our back of our minds as we move forward is going to be very key for all of us as we figure things out to standardize, because you only can standardize so much.
Yeah, thank you, Ms. Linda.
I also had a question for Linda. Maybe this is for Linda and Nancy. The curriculum you developed, the nursing curriculum, looks amazing. And I wonder, have you considered, and how easily do you think it could be adapted and translated into other languages for different contexts?
That's a great question. We have posted it on one of the SIOP International Society websites, both in Vietnamese and The website's going through some transition right now, but we knew one of the Dutch teams working in Africa and had used it to do some basic training at one of the centers in Africa. So that was our goal, was that the slides were created in English for the most part, and then translated into Vietnamese. So we brought in this beyond the Vietnamese nurses, and that was was also going to be a point of this grant for transplant. Is that we will be able to load these slides, and other people will have access. And because we are within PSYOP, many of us are reinventing the wheel with the work from World Child Cancer in Africa and ourselves, and we're trying to blend or have a library of these lectures, and then have them translated as needed into the various languages.
If I could just add one thing in addition to Linda's comments, I think that when you're building foundational education, which is our goal, then the next step beyond that becomes a little bit easier. So that if you're able to cover core competencies, for example, and basic behaviors, basic safety care, then you have an informed and educated staff nurse who can then understand the conversation and participate in higher elevation conversations about how you adapt alternative therapies and/or differences when you see them from center to center, or even from physician to physician, because that's what we see in the US right now. So you're building in not only a basic competency, but you're starting to build that understanding that fosters future flexibility and participation.
And you have to have that future flexibility, because if you've worked in transplant, nothing stays the same. So, when I started years ago, practice is different now. Even stepping back from clinical practice for a few years, things have changed. So building ability and ongoing continuing education for not only but physicians, and doing that together, and then adapting. So I think that's really key.
And one more thing, sorry, that Linda and I frequently use, and other educators frequently use, the concept of case studies. They're using this in the consortium presentations, where you have basic or foundational information presented, and then you have a case discussion, which fosters that ability to use that foundational information and then say, well, we have a situation where it's not exactly what we were taught. How are we going to work through that? And through that process allows people to integrate knowledge, discuss a particular situation, and then formulate either a resolution or a plan or additional understanding that will continue to grow with them over time, exclusive of mentorship involvement. So it really is train the trainer and building that foundation for independent collaborative practice amongst the Vietnamese staff as things go forward. Thank you.
Thank you. Yeah, I think one of our recurring themes has been capacity building throughout the course of this pathway in the lecture series, and how to do that in a partnership and in a sustainable manner. And I could not agree more, Linda. Like, the amount of reinventing the wheel that we seem to do in this space is just immense. So anything that allows us to learn and share resources between each other, I think is immensely helpful. I wanted people to know I put the evaluation link in the chat. We do really appreciate your feedback, and it's a super short evaluation, like 2 or 3 questions. If you wouldn't mind just taking a minute to do that. And then any last minute or parting thoughts or questions from anyone?
Thanks, everybody.
Thank you. Appreciate you all coming. It's truly a collaborative effort. You've accomplished just an enormous amount. Thank you so much.
Thank you. Have a good day.
Bye.